All right, well, good morning, everybody. Happy Independence Day. Today, the Pharmacy Club is excited to announce that we are starting an episodal series with our great friend and collaborator, Ms. Joelyn Poornananda from Medicare Plus Pharmacist. So today will be our first episode, and we hope to have this going for a very long time. Ms. Joelyn, thank you so much for having us in your beautiful pharmacy.
Thank you. Thanks for coming and for having an open mind and open heart to start this project.
Oh, of
I'm
course.
excited.
We are as well, and to quote Sergio when he came in this morning, wow. So a lot of people I think on the outside just see two window panes and don't realize how many love and how many medication and how much hard work sits behind those window panes. So you care to tell us a little bit about yourself, your pharmacy journey? How did we get here?
Sure, I'd love to. Thank you. Welcome everyone, and thank you for being a part of the first of many to come. So I am Joelyn Poornananda, as Mr. Drew mentioned earlier. I am a pharmacist. I have over 20 years experience in the community setting. I have been here at Medicare Plus Pharmacy from its inception in 2009. So this year we're celebrating 15 years in the business of love and care, one customer at a time. Pharmacy for me is a love, a passion. It was probably from the age of 13 when I was first exposed to pharmacy. It was for those career day events that they have at school, and I said, let me look into it, and honestly it's been there from age 13, and I'm so glad that through this project I can work with my University of Belize, because
Our university.
Right? Because it's through the efforts of the pharmacy department that I was able to come to this point in time.
Excellent. And just to piggyback on what you said just now about our University of Belize, some of our current professors and lecturers, Dr. Dan, Mr. Abu, they always speak so highly about their past students and with such pride, oh, everybody we're in a pharmacy come from our production, and it's true. I know these guys have had very long tenures at the university and are responsible for molding so many minds. Yes. So shout out to Dr. Dan, Mr. Abu, Dr. Paula, Ms. Rondine, Mrs. Turton, and
yes,
all the other lecturers who have contributed over the years. Some have retired, and rightly so, they've done their share.
And some have retired and come back.
And repeatedly retired and come back.
And we appreciate you guys. I mean, if it wasn't for your love for the profession as well, I can tell you I probably wouldn't be here. And I appreciate that.
All right.
So let's go back a little before we start with OTC. So as pharmacists, we're trained medical experts. We are focused on selling and knowing everything about medications. But there are different types of medications. You have over-the-counter, which we're familiar with as OTC. It's basically an abbreviation of the word or the words over-the-counter. So with over-the-counter, we have many different options of over-the-counter products. These are the products that are not as restrictive, they are not as potent, and they're safer to be sold to the general public. They don't necessarily need that intense engagement when you buy or when you sell the product. It can be sold in supermarkets, gas stations, and in the pharmacy. The other category of drugs would be prescription medication. Now these are what I call like the big guns. They require us as pharmacists to be more familiar with the patient. So when the doctor prescribes a prescription medication, the patient comes to the pharmacy, and as a pharmacist, we evaluate the prescription. We might need to clarify a thing or two on the prescription, so we would discuss it with the patient. So we still have to go back, talk to them, ask them, a few questions so that we can verify and support what the doctor is giving the patient. Is that clear?
I think that's clear enough. I'm just thinking about what you said about the big guns.
Yeah.
It's a very good way of thinking
Mhm.
of using that word, because I'm thinking about prescription. Like, it's imagining that you have at the back all guns,
Yeah.
because they can kill a patient, they
Yeah.
can kill a
If
person.
used
So,
incorrectly or
Yeah.
if used in combination with other medications, yeah, it could create a
Yes.
problem. And as pharmacists, we are trained to know how to identify these errors, these mistakes, or this misuse.
yeah,
And similarly with OTC, because some people might think OTC is safe across the board. But what do you think about that?
yeah. I'm still going on with your way of thinking, right? Like, for people more to like understand it, I would say, like, yeah, you have big guns that are the OTCs, right? That's the prescription. And at the front you have like over the counter. The over the counter would be small things like, I'll go Belizean way that when I'm young I used to use slingshot and the post killers and then
Oh.
stuff. So yeah, the OTCs would be like that. Those
Okay.
they can harm, they can help
Mm-hmm.
depending on how you use them, but you don't have to be that careful like holding a big gun.
Right, and even if used incorrectly, the slingshot.
Yeah, can harm you.
Right.
Yeah, the post killer, you catch your finger and
Interesting.
yeah, it's in my imagination here just going wild with it,
No, but it's good because it's really and truly a good explanation because OTC you use it for everyday
Yeah,
issues.
it's everyday issue. Like back in the days, slingshot and everyday thing. Now you got cell phones there, but back in the days. So it's a very good way of putting it. Yeah, and what are the most common OTCs you use nowadays?
Well, to be honest, there's a lot. There isn't any one single one. Actually, no, there probably is. Vicks.
Yeah, Vicks.
That's probably in
Yeah,
everybody cabinet at home.
Yeah, I've heard that Vicks cures everything
for
for.
everything. Yeah. But honestly, when you think of OTC, I kind of categorize it like I do my pharmacy. You have OTC skincare, OTC hair care, OTC flu, OTC pain, OTC for upset stomach. Each category has their key star player. But if you think about OTC for gastric care, most people remember Pepto-Bismol. That is considered OTC. But did you know that Pepto-Bismol is not given to children under the age of 12? Right? It shouldn't be. There's a specific one that can be administered in children under the age of 12. And that's just an example of why going to a pharmacist for certain conditions is better than just buy just randomly. When you think of OTC, Benadryl is also another OTC for allergies. You think about Tylenol, everybody uses Tylenol, but Tylenol used incorrectly or Tylenol used too frequently has its own problems. So that's why it's good to have a knowledge about what OTCs are available and how to guide customers even with the use of OTC, which is one that you have used most recently.
Yeah, I think one of the most common ones and the one people are doing a lot right now is Benadryl.
Yeah.
A lot of people will be doing Benadryl and they just see it at the store or anywhere and they just want to pick it up and they use it.
Right.
And for me, it's concerning as well. You have to just be taking Benadryl just like that. And here it's very popular. Everybody uses it.
And when we say Benadryl, just to put it,
Yeah.
when we say Benadryl, Benadryl is referring to the brand name.
Yeah.
So I think when we talk about OTC, we also have to make that distinction between brand and generic. So with the brand name, it means that that's the commercial name that's been marketed from the inception of the drug. And drug name is basically the drug in it that does the job. So for example, like Tylenol being the brand and acetaminophen or paracetamol being the drug. So we talk about Benadryl, but the other name for Benadryl would be diphenhydramine. And it's true. Diphenhydramine itself is one that's very widely used for many different reasons though. You know, you could use it for a cough, you could use it for allergies, and some people even use it to sleep at night.
Yeah.
You know, it's used at different strengths, obviously, and for that reason, when you use it at night time, it's be the highest dose for that. But what happens when you take it at that strength? You sleep.
Sleep, yeah.
So if you're driving, you gotta be careful. If you're operating heavy machinery, you gotta be careful.
Yeah, and another thing is the effect it has when combined with alcohol.
Right.
That's something very, very dangerous, and
Yes.
people don't really think about it. People don't know about it, and when you get it from if you get it from a grocery store or a Chinese store, we would say, like here in Belize, they won't explain this to you.
Right.
They don't explain this to you. They don't expect, like, you don't know what can happen. Some people just take it and don't know, and that's okay to not know, but that's why you get it from a pharmacist. It's best to get it from a pharmacist.
I agree with
You
you.
come and you ask your questions, and I think that's the way, we're here for that.
That's right.
Yeah.
We're literally here to have the conversations. If you're a mother and you have it home, or if you're a grandmother and you have your acetaminophen or your Tylenol in the cabinet for when your grandkids come over, one of the things that I love to do with my customers is we label it so that they know for this age or for this weight, this is what you would do. But if when the child grows up, you need to change that. So we put there, remember, as the child is growing up and increasing in weight, we need to adjust the dosage. But that's not something you would find, that kind of advice you don't get from the grocery store.
Yeah.
I agree, we need to have accessibility, right? That's why we have grocery stores, gas stations that carry OTC products. And that's important, because if someone is at home with a baby and that have fever, you need to get that medication
Yeah.
for the baby.
Now that they're talking about that, I'm thinking about some issues I've had with some people, right? I've heard some people saying, pharmacy, I think pharmacy or medicine in general is a scam. Because I can go to the Chinese and I'll get this for a price, and then I go into the pharmacy and I get it for double the price, and I think that's a scam. And I've heard it a lot. It bothers me a lot, and I think people don't know, they don't understand the kind of pricing or why it's that way. And another thing is self-medication. Like if you're buying things at the store, you're also self-medicating. So I would like to talk to people about self-medicating. You can explain about the risks of medicating. That's something we really have to teach the public about. So
Right.
I would like your input on self-medicating. I know what it will be like. For example, here we take very, very, very good care of medications. We make sure the temperature is right, and for that you need AC, and you need proper handling. You need people that are here looking at things, checking the expiry dates and working on that. And I know those are things that are not happening at a grocery store. The temperature might not be one, and that affects the pricing as well. Yeah, so I would like you to touch on that aspect on the self-medicating.
Okay. But that's a good question, Sergio, because for example, when you think about the years of study at UB, the sacrifices you make at UB, you are there to learn as much as possible, so that when you are then in your pharmacy or you're the person behind the counter, you understand that the responsibility of that patient and the medication you're giving the customer, the patient, is on you. And I can't speak to grocery stores or gas stations, but in the pharmacy, you have certain standards that you need to maintain. That is a requirement across the board. As long as you open your pharmacy, you need to ensure several things. You need to ensure that you have a licensed pharmacist there. Why? Because we are the custodians of every single medicine in the pharmacy. It's our responsibility. Anything that leaves that pharmacy, the pharmacist has to be aware that that's, to me, it's a privilege. We also have to maintain certain standards, such as temperature control. Why is that important? Because we need to ensure that the product that sits on the shelf waiting for the customer to come is kept at the manufacturer's stipulation temperature. So we could ensure quality. We could ensure that shipping into the country and reaching to the customer is at its best quality possible, keeping that temperature. We need to ensure it's not expired. That's something also that we have to look at. We can't be giving them substandard or expired medication. We have to buy from reputable, licensed wholesalers too. If you're an importing pharmacist, meaning you import into the country and you retail, then you understand the chain from the importation to your counter to your patient. But for other pharmacists like myself, we don't import, we buy locally. So I have to buy from a licensed wholesaler. Why? That ensures that what I have on the shelf is not falsified, is not substandard, and it's quality products that we're giving to our customers. So when you buy from a pharmacy, you are supporting a professional who has invested time, years of love, joy, sweat, tears in that profession. You're also supporting the business, their staffing. You're supporting wholesalers as well, who are also Belizeans who have invested in that aspect of pharmacy. So when you go and you buy, you support Belizeans, and I love that idea. And you're also supporting the University of Belize, because most of us studied right here in the country, and we are here putting our all right back into our communities.
Yeah, and I think that's the main focus, right? We're here to help the community. We're here to engage with them, and it's sad that people don't really, and there's a lot of people that don't really have a friend, a pharmacist friend who they can come, a person who they trust. They can come and have some conversations about this stuff, and with that we're here to help them, and people would just come to a pharmacy and I wanna and take it and go, and
It happens.
it happens a lot, I think.
Over the years, we've conducted several wellness projects here in this pharmacy in Medicare, and the reason for that is to create spaces that customers can develop and learn more about what we're doing as a pharmacy. These projects they're very numerous. They're very dear to my heart because it allows me to engage with the community even more. And these community wellness projects are an extension of what I do in the pharmacy. They're an opportunity to reach more people in different areas of the community, for them to know that they have a pharmacist on their side. Regardless of which clinic they attend, who's their preferred doctor, or whatever it is, it's my way of reaching them and explaining to them, hey, you should have a pharmacist in your camp. You have your doctor, but you should have a pharmacist that you could always go to bounce ideas around. Hey, I am feeling this, or I've had this medication, or what do you think I should do? I want everybody to know that if you develop that relationship with the pharmacist, you literally have a medical professional who is looking out for you. That's your pharmacist. We see charts. For those that work in a hospital setting, they see your medical charts, they see your lab results. That's a second opinion by a medical professional without even knowing. And then we're in the community setting. We are the most accessible medical professional in the community. I mean, you can walk into a pharmacy in every community, every day of the week. And I applaud the pharmacists who've been opening extended hours, extra days, because the goal there is to make themselves even more accessible. So you should be able to walk into any pharmacy, meet your pharmacist, talk to them. And I encourage all my friends, all my patients during these wellness projects or here at the pharmacy is develop a relationship with a pharmacist. You need that person there. If you're treating someone, for example, with dementia, Alzheimer's, you want to be able to have someone who has the experience and the knowledge to look at your loved one's medication history and be able to tell you know what, maybe we should ask the doctor to tweak this here. You might not be able to access a doctor immediately, but you could go to your pharmacist. Is there something I need to do different? I've been noticing X, Y, and Z now, and I want to know what more can I do? Your pharmacist is your right hand man.
Yeah, and I like that you're saying that, and you're saying in the hospital setting the pharmacist plays the second opinion role and the verification of charts and yeah, and in the community setting I feel like we have a first opinion as well, and I encourage my friends, like for example I talk to my friends and I tell them, you know, your pharmacist can be the first person you go to, and that can actually save you money.
Yeah.
Because we gotta be realistic, right? There's some people that are out there and they don't have the money to be going to the doctor and paying for consultation and all of that, right? So I tell them, okay, there are minor things that you might not need a consultation with a doctor. It might just be a little symptom you're having up or something, and you know, but still you can come and visit the pharmacist. The pharmacist there will ask you some questions and see what you're going through, and the pharmacist will tell you, okay, you know what, I think you really have to go to the doctor.
Mm-hmm.
And that's how the pharmacist can guide you and help you out. You know, it's actually saving you money, because you might just have, you know, something and you're a small little thing and you're concerned, but because you're concerned you'll go to the doctor and maybe it wasn't that bad, and you ended up spending money and you didn't have money, so you're taking out of your, you know, maybe your food budget or stuff like that.
Mm-hmm.
It's good to have a pharmacist friend. You know, if you have a little, you know, pimple or a little, you know, something there, you can just come and, you know, the pharmacist and, you know, hey, I have this, what do you think? Should I go to the doctor and this and that? I think that's the way we can give a first opinion and guide the patient on where to go and how to go.
Definitely.
And yeah, going back to the OTCs, right? The pharmacist right there can just say, okay, you know what, for this you might just need an OTC and over the counter, and you should be good to go.
Right. And one of the things that we have noticed too is the misuse of prescription medication as if though it is OTC. And you know, that might be where you might have been taking prescription medication and not knowing that it's you've been using the prescription medication as though it's a OTC. And then that's where the pharmacist now, we have to kind of like crack a little whip, so to speak, because we realize the dangers of doing that. And that's where if you come to the pharmacy, for example, we have a lot of people that come for certain painkiller, like diclofenac, let's put it out there.
The red pill,
yes, the red capsule, everybody wants that one.
Yeah.
But it's also very important for me to say that it is a prescription medication. It should not be sold in the pharmacy without a prescription. But the discussion has come up often, very, very often with pharmacists. Okay, so then how do we handle that situation? Because customers come in demanding their diclofenac. But I feel that that's one of the reasons why I like this idea of doing a discussion about it, because it's allowing us to educate the public to understand that diclofenac, it's very useful, don't get me wrong, but it shouldn't be used for longer than it has been prescribed. And if it's not been prescribed, you shouldn't use it. There are other options that are safer, that won't cause any kind of stomach issues. It won't cause any long-term kidney problems. So we have other alternatives, such as using something more natural. And that's something that I love. I spent a lot of time doing my own research on natural supplements and how to use those to support your health. I am big on preventative care. You know, you might you had an injury. You don't want to wait until it's aggravated again for you to then run to diclofenac. You are trying to recover right now. Start taking your omega-3, your turmeric, your glucosamine conjointin. Build back so that you don't have to be on that medication. Those do far better for your overall health, your brain health, your immune system, your gut health, than taking diclofenac, which will only aggravate your gastritis, damage your gut health, create more issues, affect your gallbladder, affect your, and then it leads to something else that could be avoided. And that's why, it's important for you to have a pharmacist in your camp, because that pharmacist is there for you. That pharmacist can be looking from a bird's eye view of all the different things that could be affecting how you're progressing with your injury, or you're progressing with your treatment for hypertension. If you come in for example, OTC, we go back to that again. You constantly come in for diclofenac, you constantly come in for Tylenol. Oh, you just have this constant headache. But you might not realize that it's because you've missed your pressure pill. You've not been taking it for a couple weeks, and then you've been taking coffee every morning because you want to, keep your energy up. But those two things, not drinking your pill and instead drinking some caffeine every day, that is what's keeping your pressure high. So, okay, when you come in, sit down, we check your pressure, and we have to have that dialogue, But I won't know if you are on pressure pill if we don't have that communication.
So, I know that earlier we kind of talk about OTC medication, but forgive the ignorance, but who actually chooses or decide what medication, OTC, or which one you have to get a prescription from a doctor? Who responsible for that?
All right, that's a good question. It's not us. It's not the pharmacist. Really and truly, this is through the health authority, through the government of Belize, through the Ministry of Health. They, based on different health policies that they sign on to, some best practices as well, globally, regionally, they would vet all the medications that are available, and they would determine based on the safety, the risk of misuse, and self-monitoring. They would then determine if it's a risk to the public, if it's something that could be sold without the need for a pharmacist or a trained medical person intervention, then it can remain as OTC. Also, think about it. The FDA in the USA, they determine prescription and non-prescription.
The Food and Drug Administration.
Right, the Food and Drug Administration. When the product is first manufactured, they also determine if the product is prescription strength based on the safety, the risk of use, and the self-monitoring. And for example, you might have a product that has a prescription strength and an OTC strength. For example, omeprazole. Government has 3 lists. These 3 lists determine where the product would be sold and what strength is sold in each locale. The first list would be general OTC. So that would include your grocery stores, your gas station, your corner shops. They can sell the products on these lists, and it would be at a specific strength specific quantity as well. Then you have your pharmacy OTC. They could be sold in the pharmacy without the need for a pharmacist to be the one educating. Then you have pharmacy sale, which is now the products that are sold only in the pharmacy without a prescription, but there has to be some kind of counseling that is done before.
I see.
Then your prescription and then your control medication. Now, if the drug is not on this OTC general sale or the pharmacy OTC sale, then it's automatically prescription medication. And that's mandated by the Ministry of Health and enforced by the Ministry of Health.
Well, I have several concerns with this, hearing that some of these medications are sold OTC in or general stores, because let's be frank, the majority of our stores in our country are Asian owned establishments, respect to the Asians. However, on every box of anything I've ever seen in a drugstore, they have expiration date, they have how to store it. Now, every pharmacy that I've set foot in is sealed up. I don't think that just because the pharmacy wants to stay cool, but there is you spoke earlier about a responsibility to the medication, and storage is one of them. But I don't see many air-conditioned grocery stores. So for me, I can't imagine personally, and this is just me personally, walking into my neighborhood grocery store to grab a box of omeprazole and think, well, this certainly is safe. Because these stores are hot, and if this medication has been sitting on that shelf for a week, for a month, for a year, sometimes people don't watch expiration date. They just grab the box and go home and take the pills and then wonder why they work. You know, oh, I take that, you know, but it never really worked for me. But so I guess for me, you also mentioned earlier that accessibility is a big thing, and I 100% agree. Is there something done by the Ministry of Health and Wellness to mandate the same? There is a responsibility that you guys have to medication. Is that the same thing that exists in these other locales, these other settings?
Yes, Ministry of Health and Wellness does do inspections in the pharmacy, and they do in the grocery stores. For example, if they were to go and they see that there is substandard product or a product that is not kept at the manufacturer's stipulation temperature. For example, each medication would have storage conditions. It tells you to keep it in a cool, dry place, protected from light, and at a temperature lower than 25 degrees Celsius or whatever it could be. That's important because it ensures that the temperature of the product is kept
constant
to ensure that the quality is safe.
And I would think the shelf life as well, right?
Yeah,
because
definitely
if it's supposed to last an entire year, if it's not kept in the optimal setting, then it might go bad before
Right.
and not have the same efficacy, yes?
Right, it's true. And when the drug inspectors would go to a store and they would find a product, for example, let's say on a hot Tuesday afternoon in Belize, temperature could be above 30 degrees, then it's not being kept as required by the manufacturer, so they could decide then what will happen. Similarly, which is why pharmacies, as you mentioned earlier, they all have air conditioning, because as the custodians of most of the medication in Belize, we have to ensure that quality. We have to ensure that it is safe, that we are meeting all the obligations to keep that medication on the shelf.
That's a great point. And you know, additionally, some of these medications say keep it out of direct sunlight.
Yeah.
And sometimes you walk into these stores and they're right on the shelf where that sun, they beat that product all day, every day until it moves. I'm just concerned, I guess, for all Belizeans, for everybody around the world, if you need to get these medications, then for me, I prefer going to my neighborhood pharmacy and getting it there. I know that that person will definitely be knowledgeable. I know that that place will definitely have the optimal storage settings, you know.
You said something there, actually you said around the world. In other countries, grocery stores have air conditioning, so that would be a plus. Here in Belize, for sure, that'll be fine. But also, I find it as a very interesting point, Drew, because for me, it also means that there is need for more pharmacists.
So another thing is, and I guilty of this personally, the doctor prescribe a medication. At their consultation, they tend to tell you how to take it. And then you go to the pharmacist, and the pharmacist also reinforces what the doctor said. Sometimes they offer a bit more insight, a bit more information. But when I go home and I open my box, I just take out the paper we fold out and toss it away, because I don't know everything I need to know, because my doctor and my pharmacist says so. Is there, is that good practice, a guilty, or how important is it to read and follow the labels and the instructions when it comes to these medications?
Well, honestly, think about it this way: the label is your instructions manual. You would want to know how to use it. And when you do go to the pharmacist, we also make sure that you are aware. Is there anything else that you need to know about the medication? Anything else you want us to go over before you leave and start taking it? Remember, your health and the progression depends on following the instructions laid out by the pharmacist, and that's extremely important. And if you're still unsure, give us a call. That's what we're here for, to ensure that you get the support you need to see through your course, complete it, and get well.
I had an experience around that. I did some experiential learning at St. Luke's Hospital here in Belmopan, and big up to Miss Rosa, big up to Jerry. I remember whenever they dispense medication, they always went out of the way at the end of explaining, any labels, any auxiliary, what have you. At the end, they would reinforce and say, did you understand everything that I said? Do you have any questions, additional questions? And it's the same thing that I know you guys practiced here when I was here. It's so important. And you see, we kind of spoil me, because that's been what I've seen at the places that I've been working at. So I feel that this is done everywhere, but we can't assume that every place is the same thing, So I feel like these are very important things to reinforce, to ask, to ensure that the patient, the customer, understands completely the medication that they've been given, and how to take it and so.
Right, and it's also the opportune time for us as pharmacists to ask, are you on any other medications? For example, if you're diabetic, and you didn't get a prescription for your diabetic medication with us, but you came to buy something that's for cough and cold. So now it's that little dialogue that we need to have to understand what your symptoms are. So when the pharmacist is asking you, so how long have you been having these symptoms? What do you feel? It's not because we're nosy. It's because the more we know, the better we could guide you. And then, are you diabetic? Are you hypertensive? We need to know, because then that would then help us to recommend something that's safer for you. Because you might say, oh, it's just a cough and cold medication, but it would have sugar to sweeten it. Or it's a lozenge, or it's a gummy, they will still have sugar. So that would affect your glucose level at the end of the day. Or if you're hypertensive, you know, taking it along with a medication for flu that has in caffeine, or it might even have in some of the other ones that, like, now we know that the FDA has a warning, or they're considering to start evaluating the effect of phenylephrine on with hypertensive. We have to consider that too. It might not be law, but it's best practice. And as pharmacists, we are lifelong learners. There's something new coming out every day, some different protocol. We have to be aware of it. It's not your responsibility as a patient, it's ours. And the more you share with us, the better we can guide you. And it's just a conversation.
That's excellent. You mentioned something just now around that a patient might have, you know, diabetes but coming in for a cough and cold. It had me thinking that some of these OTC medications, you know, could interact with other things, maybe herbal, you know, remedies,
yes.
or alcohol if they consume it. So is there any correlation to prescription drugs and how they can interact with other things?
Definitely. For example, if you're taking a course of antibiotics and you're a female and contraceptive, it would be good to tell your pharmacist, because the antibiotic might actually nullify the contraceptive, and I mean, that's not our goal. We're not here to have any oops or any problems.
That's a big oops.
That's a big oops, right? But you have to talk to your pharmacist. Explain to them what's, you know, the treatment you're on or what you take. If you're on certain herbal supplements you mentioned, like garlic and ginger, those are also used as blood thinners. And if you're a patient using warfarin or one of the others, you have to be very careful. So it's always good, regardless of where you bought your supplements, speak to your pharmacist. And I'm not someone who really encourages what I call polypharmacy, meaning going to many pharmacies, because you want one person to know your medication history. Go there. If you buy anywhere else, you want to go to someone who you can trust and who is knowledgeable and can share, and you can have that discussion so you're armed when you walk out. Okay, I might have gotten my, like I mentioned earlier, diclofenac for my knee pain, but I have gastritis, and then I always buy omeprazole for the gastritis. Your pharmacist should be guiding you in, let's get off the diclofenac or off the NSAIDs, the anti-inflammatory drug, and try find something more natural. For example, like I mentioned, like
your Vicks.
Your Vicks.
Remember Vicks fix everything.
Yeah. But like your turmeric, you might decide, let me add some turmeric and omega-3, do glucosamine, or I might do an anti-inflammatory cream on my leg instead of drinking it every
How about
day.
diclofenac topical?
Topical diclofenac, it's also an option.
It circumvents the whole stomach
It
issue,
surely
right?
does, and it's targeted to the area that you're having inflammation. That's also an option. And for example, we spoke about omeprazole. Omeprazole is a proton pump inhibitor. It's used for gastritis. So you might say, I was having a large plate of rice and beans and pepper and onion sauce and
You don't have to do me like that, Miss Joe.
and now I'm in pain, I need to go drink my omeprazole. Or you might say, I skipped breakfast and I had a Coke. Stay off the Coke. I had a Coke and now I'm having pain. And lo and behold, you take omeprazole almost every day. Even that is not good for your gut health. And having poor gut health can lead to so many other conditions. Constipation, a weakened immune system. You have to be considerate of all the things you take and the implications it have on your health. But you know what? The beauty about that, Drew, is you have a pharmacist that can help you with that. That's what we're here for.
I have several things pop up in my head as you said.
Let's hear
No,
it.
well, the first part when we talk about Coke, I remember Dr. Opala. You drink Coke? That's okay. Once every 3 months.
Yes.
You know? And we know how we Belizeans go with soda. We like drink 2 or 3 a day. You spoke about there are conversations that we have and that rapport that you build, that relationship you build as the pharmacist with your customers, with your patients. But I've also seen that there are times when patients come in and it would look to me as if they just want to grab the pills and go. You know, like they don't sit to, and I've heard them ask sometimes, have you taken this medication before? And sometimes the answer is no. And I've seen that the pharmacist has started their counseling and the customer just, I need,
Right.
that's difficult because you feel, I know I would feel as if I'm not doing my full job. How does one navigate that little nickel there? That little difficult.
To be honest, there is not one size fits it all, right? We have to start the conversation. If you start it but you might not finish it today. I've had instances where, for example, a young lady came in and was talking about a situation she's having, and she was like, Miss, I really can't, I have Antaxidate for me, I'm just coming and check if you don't have it, but alright, thanks. And she left. But we had spent a couple minutes talking about it, and for me, I prefer to know that I did my best in that first 5 minutes, and it might, or 2 minutes, who knows, but it might reach somewhere. And she came back a couple days after and she said, you know what, I have time now, I'm on my lunch break, make us see the products you were talking about.
Good for her.
Yeah, and it was important for me to know that she felt comfortable in coming back and talking about the situation, because sometimes it might seem like the most uncomfortable conversation, but you're in the right place. And from the pharmacy, we do make referrals to different doctors that would need to follow up, because we're not trying to be doctors here. You know, we know how far we can go. We are not doctors, we're pharmacists, and sometimes if the doctor is busy, that's where we can then say, okay, you know what, you are going to see internists because they felt like, oh man, they were in bad state, but they might not need the internist, they just need to go to an OBGYN. You know, so we have to remember that the conversation is never not worth it.
You know, you mentioned just now that with that patient there, and good on her and good on you, you plant the seed, the rain watered it whilst she was away and she came back as a budding little plant. But you mentioned something that it's because you created a safe place, a safe environment that she felt comfortable enough to come back and have that conversation. Speaking of safety, these OTC medications are, because they're over the counter, they're easily accessible inside and outside of the pharmacy. Should these medications medicines be considered safe for kids, pregnant women, maybe elderly, maybe geriatrics even? How does that work?
It has to do with age and the state of your life at that point in time. So you remember, we're going to go back to UB right now. You remember that amazing pharmacy class called pharmacokinetics? That's where that topic comes in. It's right here. So please pay attention to Mr. Abu during pharmacokinetics class, because to me that is the essence of pharmacy, in that medications that are made for an adult should not be given at the same strength to a child. Their liver is not developed as ours is. Their body cannot tolerate the same effects of that medication as an adult. And even if you're pregnant, remember you're carrying a young baby, and the medication might impact that child, and you might not even know it. You think you drink your cough and cold medicine, and lo and behold, it's going straight through to the baby. So you want to be very cautious. And if you're elderly, why do you think that's important? Because your metabolism slows down. The way the body starts to absorb, and it could be too concentrated now, or it's slowing down, that it's not passing through the digestive system the same way, and it's absorbed more easily, and that could be not good, not bueno.
No bueno.
No bueno, no. So you want to be careful with that, and that's one of the reasons why Ministry of Health ensures that for babies under the age of 2, their medication is kept in the pharmacy, because you need competent professional to help dose it, and that's the safest thing. For an adult, you can have, for example, cough syrups have from sometimes age 2 up. We don't want to encourage patients to give it to their babies. It's best to find a pharmacy. Or what a wonderful thing that Ministry of Health also does is that they have community health workers. You could go, please, find out who's your nearest community health worker if you're in the rural areas, and reach out to them. They also have a small amount of medicine that they can to share in case of emergencies. So you have your community health workers, you have your pharmacists, your pharmacy technicians, because that's one of the other reasons why I really wanted for us to have this conversation, because I hope that through this we could spike the interest in other persons to go and study pharmacy. And you might say, oh well, that's a tough subject. I don't know math, I don't know biology, I'm not interested in it. But you could find a pharmacy, go in, maybe ask if they have a vacancy, and learn from that angle. Test out the waters first to determine if you like pharmacy, and then you can go study in UB. That's a wonderful route. And if you're interested, what can they do to join UB? Do you know?
Yes, so you can visit the University of Belize page on the internet, the World Wide Web. You can find them on Facebook. There is a big button that says apply now. You click that apply now button, it will take you to a whole other page, then you just go and fill them out, and you can really all you need is a background in biology, in chemistry, and in math. They say that you have to have 100 per hour a day.
Can I
Yeah,
butt in
absolutely.
right here? I certainly did not have 100 in my math class. As a matter of fact, my math teacher was not very pleased with me in high school with that. But guess what? Everything you need to know, they will be teaching you. You can find, and with the phone and technology now, you can even start doing your own kind of research on it too. So don't be intimidated. Pharmacy is a wonderful career. It's a rewarding profession to me. I mean, I might be biased, but to me it's the most rewarding medical field, because you're here one-on-one with customers. You also have doctors that you can rely on. You have lab technicians that you work with, nurses. You're literally touching all the areas in medicine. And who knows, you might decide, I'll start pharmacy, and then you end up as a doctor. It's awesome. So don't be intimidated.
So the degree at the university is a 5-year bachelor program, 4 years of theory, and the final year you'd be in experiential learning, doing rounds. And right now, currently, the Ministry of Health has 2 scholarships available. They've just started a couple weeks ago, maybe a month or 2. They're still looking for people to apply, so you can be that next potential pharmacist coming into the university. To Mrs. Joe's point, we share the classroom with nursing students. We share it with med lab students. It's a great opportunity to start building rapport, because you guys, we will be working together for the rest of our lives. It's a joint field, the medical space, UB also has a School of Medicine that has now been started, so it's another option to come to the university. But of course, we want you to be pharmacists. So, Ms. Joe, thank you so much for opening this beautiful space to us to have this first conversation, hopefully the first of many.
Oh yes,
And we're definitely excited about it. So thank you so much again.
thank you too, and all the best with your celebrations for Pharmacy Week.
All right, thank you. Think health, think pharmacy.